Gestational diabetes is a common metabolic and endocrine perinatal complication that has grown to become a worldwide health problem. Diabetes refers to high levels of blood glucose. It's important to improve glucose metabolism in women who are pregnant because it prevents excessive accumulation of fetal fats and emphasizes weight loss measures before pregnancy. Normally, glucose is carried by the bloodstream and delivered to the cells. Glucose does this with a hormone called insulin. Insulin is produced by the pancreas, and insulin induces the cells to take up glucose, which removes it from the bloodstream. But with diabetes, glucose is not able to enter the cell, which causes high blood sugar levels. The placenta is a temporary organ that provides the fetus with nutrients. Some hormones produced by the placenta affect insulin production, which makes insulin less effective. When the placenta grows too large, it becomes difficult for insulin to do its job. When glucose levels in the body are constantly high, the fetus can grow too large and have birth complications because too much nutrients are being provided to the fetus from the placenta. When glucose levels are extremely high, the baby's pancreas will develop an excessive amount of insulin. After the baby is born, it will become hypoglycemic because it has high insulin levels, but no more sugar from its mother. Women who are at risk of developing gestational diabetes are women who are overweight and obese, lack physical activity, are Black, Hispanic, American Indian, or Asian American, and also women who have previously delivered babies weighing more than 9 pounds. Gestational diabetes can be successfully managed with healthy diets and physical activity. Medical nutrition therapy includes a nutrition diagnosis with therapeutic and counseling services to manage diabetes. The designing of meals with controlled carb levels for nutritional adequacy with normal sugar levels and preventions of ketosis is necessary because dietary interventions with lifestyle interventions have been shown to be more effective in reducing the prevalence of gestational diabetes. Carbohydrates are the most important nutrient which affects glucose levels after meals. Another factor includes glycemic index, which categorizes carbs based on its ability to increase blood sugar. In a cohort study, there were 3,060 Chinese women whose food intake was evaluated during their second and third trimester. The study showed that when a pregnant mother received dietary fiber, a reverse relationship was observed with the risk of gestational diabetes. The evidence grows of the positive effects of high intake on vegetarian foods such as fruits and vegetables, and a low intake on fatty foods in the prevention of gestational diabetes. A specific diet, the Mediterranean diet, has been also shown to lower the risk of gestational diabetes and improve glucose tolerance in women with gestational diabetes. The Mediterranean diet is a heart-healthy eating plan which emphasizes healthy fats, whole grains, fruits, vegetables, beans, and nuts. The Mediterranean diet was inspired by eating habits of people who live near the Mediterranean Sea. Pregnant women who eat a Mediterranean diet have children with a lower risk of obesity and weight gain. There is a link between childhood obesity and a pregnant woman's diet. Chronic complications may arise when diabetes is left uncontrolled or undiagnosed. High levels of glucose will conjugate with two different types of molecules, proteins and lipids. When glucose binds with proteins and lipids, this creates a very inflammatory molecule. Inflammation in the blood vessels and LDL deposition within the tissue will lead to something called atherosclerosis. And when protein deposits occur in the blood vessel and around the membrane, we get hyaline arteriolosclerosis. A combination of the two effects will lead to a decreased blood flow as well as decreased gas exchange across the vessel. There are 4 diseases associated with this non-enzymatic glycation. If it's developed within the wall of the heart, this will lead to coronary artery disease. This will also happen if atherosclerosis develops within your lower extremities, which can also lead to ulcers. Additionally, there can also be a decrease of blood flow to nervous tissues, leading to strokes. Vessels within the retina can be affected, which can lead to microaneurysms, which will affect a person's vision. As previously mentioned, gestational diabetes can lead to type 2 diabetes in both the mother and child. Both can be avoided and treated with medical nutrition therapy. Choosing the right foods can be tough. Here we will talk about the diabetes plate method, which is mentioned in nutrition therapy by dietitians. This method can simply be achieved with a healthy portion of vegetables, proteins, and carbs. To start out, you will need a plate. Divide your plate in half and fill it with non-starchy vegetables. This will include vegetables like broccoli, mushrooms, eggplant, okra, peppers, onions. These vegetables do not increase your blood sugar drastically and are high in vitamins and minerals. Next, divide the second half of your plate in half. This will include lean protein. Protein is one of the essential macronutrients which builds and repairs most of your body's tissues and organs. Foods will include types of fish, chicken, turkey, and more. The last portion of your plate should be filled with healthy carbohydrates. This will include foods like fruit, beans, and whole grains. To conclude, gestational diabetes is a growing health problem for women during pregnancy. It is a common complication that increases the chances of type 2 diabetes for both the mother and child. A low glycemic diet diminishes the risk of macrosomia in affected women. Obesity is a challenge in patient counseling and intervention during pregnancy, and managing the amount of nutrients to maintain a healthy diet may be difficult for some women who are pregnant. This proves the importance of medical nutrition therapy because nutritional intervention implemented into a pregnant woman's lifestyle is one of the most important and effective treatments for gestational diabetes. As studies have shown, healthy diets before and during pregnancy can decrease the development of gestational diabetes and type 2 diabetes. Thanks for watching.